For y'all that don't know me, my name is Laura Thompson, and I'm CTL over on CCU on weekday night shift. We'll be talking to you today about the Pleurx drainage system. Some of us have already seen it, us in CCU and PCU, which is basically where they're going to be kept. What is the Pleurx? Pleurx drain system is used for patients and family members to help manage fluid drainage while at home for recurrent pleural effusions and for malignant ascites. Malignant ascites occurs in about 50% of patients with cancer, with pancreas, liver, biliary, ovarian. I'm sorry, I'm really nervous. I don't know why. I don't know why. Because I know y'all. Colon, lymphatic, uterine, and cervical. The pleural effusion is due to lung cancer, breast cancer, ovarian, congestive heart failure. The benefits, independence and convenience. Most of these patients, they want to be at home. They can drain at home. Reduce hospitalization and outpatient charges. Improve symptom control and pain control. The drainage system is the bottle. Of course, this is your bottle. Your roller clamp, your catheter, which we'll go over that a little bit better. The cuff. The catheter is a 15.5 French silicone catheter, and it's fenestrated to help fluid come through. How to drain. Okay. What you're going to do is you'll have a dressing on, okay? So you'll wash your hands, and you'll take your dressing off. You'll look at your site, inspect it, see if there's any redness, any fluid, excess fluid drainage, anything like that. If there is, you're still going to drain yourself. And then when you get done, you're going to call the physician and say, hey, I got excess fluid, drainage, my site's infected or whatever, okay? So, let's see. I'm sorry, I couldn't remove gloves and wash hands, but after you remove the dressing, you're going to wash your hands again because then you're going to put your gloves back on. So you're going to open your package, which is this here, and arrange it. You're going to have enough counter space, and you have 3 alcohol swabs, some gauze, a foam patch, your gloves, an emergency clamp in case something happens. You have to emergency clamp yourself off. A dressing, sorry, I got all my stuff mixed up. An extra cap. First things first, you're going to clamp your line because the bottle is vacuum sealed, so you don't want it to not be vacuumed. So you clamp it off. This is your access catheter tip. You're going to remove this catheter. You're going to remove this, put this down on your blue pad, make sure it stays sterile. Then you're going to get your catheter end, your access end. You're going to uncap it. It'll be this kind of cap right here. You uncap it, clean it with the alcohol swab, and then, you're going to insert your catheter until it clicks. It just made a little, I know y'all can't hear it, but it made a little click. Alright, so this part here is not completely pushed down into the bottle, of course. It has a little safety clip. You're going to pull that off, and then you're going to take this and you're going to push it down onto it until it seals. And then you're going to slowly release your roller clamp. Drainage should take about 5 to 15 minutes. You may experience some pain while you're draining, and from what I got on the website, that's pretty normal. If it starts to get severe, then you just roll the clamp back down, start clamping it. You can let it clamp for a few minutes, see if that helps, and then slowly, release the clamp again. If it continues to be severe, just stop. All right. So, undoing it. this off. Of course, this is clamped. I apologize. The color of your drainage may vary. If you're draining from, the process is the same if you're draining from the chest or from the belly. If it's from the chest, it's 1,000 mLs, no more than that at home. No more than 2 from the belly. So you take this off. You're going to put this little clamp back on because it comes with a cap. You're going to take an alcohol swab, clean around your site. It's going to be finished right now. You're going to clean around your site. You're going to take your dressing, your sponge, put your sponge up, loop your catheter end around as best you can, and put that over top of it, and then take your catheter and put it over top of it. Patient teaching. Teaching the patient and the family will begin while they're here in the hospital, how to drain, how to change the dressing, teach them for signs and symptoms of infection. The social worker, which is Regina, is going to be very involved in this. As soon as she knows this is going on, she's going to contact their home health services or hospice or what have you to get supplies set up. The Pleurx drain kits, they should be sent home with 4 per the policy. It says 4 in there, and that's 6 to 9 bottles, and that should do them until supplies come. 1-800-PARAFUSION. A very important part of it. Even though Regina is going to be on top of it, getting the supplies ordered and stuff, we need to make sure that they call the 1877 number when they leave, them or the family, because that ensures that they know their supplies have been ordered, or if not, they can get them ordered so they don't run out of time. Thank you. Let's see, there are some things.
They drain every day?
No, they don't. It's per the physician. Well, they can drain, I think it's 1 day to every 3 days, right?
It varies from physician to physician. Yeah. If they're trying to be really aggressive with their treatment, they could have them drain every day for the first week, but most of my physicians are every other day or PRN.
Okay.
Just depends on what they're, if they're trapped lung, if it's never going to fully expand,
right,
then they just want to keep that patient comfortable. So the physician will sign off on what he wants training to be.
Our policy, I know it says some of the things that I should tell you is we can flush. Our policy is not completely done yet, so this will be added. They can be flushed, and of course we have to have an adapter because none of our stuff fits on to that end. So we have an adapter here, and these are going to be kept in the CTO office.
On CCU, and I'm not exactly sure where PCU is going to keep them, but you could follow up with Christy, yeah, and she'll
but
direct
if
you on that.
for some reason you can't find them, you know, there's some over in the CTO office on CCU. So this has to have an adapter. This will also hook up to an atrium. Have to have a Christmas tree to do it, and in that case, you know, the 1,000 or 2,000 mLs is not going to matter because they're going to be continuous. Let's see, of course you get TPA, but they'll be doing that. Position. Dressing changes, of course, with every drain, but if it gets too wet when you take a shower, if it's just it gets nasty, you can feel free to change it.
I just mentioned, and you touched on this, the ICU and PCU, or ICU and CCU have the supplies they need. I just bought some for the PCU, I'm not afraid of that. Mm-hmm. So the dressing changes come in a case, so don't feel like you ever have to go looking for it or open anything special. They have a box of dressing changes. We have a separate box of catheter access kits if you need to access the catheter. And then also, she mentioned the Pleurx, or Pleurx back. There's a special drain, so you don't have to open up anything. They've got the Christmas tree adapter and the drainage kit all comes in one little case. So you should have all this on your floors and readily available if you need it.
Are there common issues that come up with the catheters as far as troubleshooting? Have you?
No, I mean, really, I don't want to, jinx myself, but it's really a simple process. The doctor will put it in very quickly, and as long as we do a good job of just teaching the patient and letting them know where their supplies are coming from, it's a great product. It gives them the ability to go home, and I mean, 3% of the time it'll occlude, 3% of the time it'll get infected, but I mean, that's usually after long-term usage for these patients that have ascites that have, they keep these for years. As you know, patients that have malignant ascites, I mean, they don't live very long. Most of these people expire with them, and they live 3 to 6 months. So it just gives them the opportunity to be with their family, be home, and be comfortable.
Right.
So. That's it. You did a great job.
No, thank you.
How much is the? I do have one question. Because this actually happened. We have a patient with one of these come into the ED. What would it just be better for us to call someone in TCU, or what do you think?
Well, did they come in specifically to be drained? I mean, what was the situation like that? I'm not.
They had their catheter in place and hadn't been drained for a while, and they had not followed up with their physician.
Okay.
So the catheter had just sat there, and Dr. Lechmedial felt like they needed to be drained, but when he got to looking at the ultrasound, he said that they didn't, because that was the intent, was we were going to go over and drain the patient. So then he changed out the tubing and everything on the patient, and then he sent the patient home.
Okay. And
you guys called us,
yeah,
and we got all the supplies, and we came over at the bedside to take care of that.
Probably us or PCU, whichever.
Okay.
Would be.
So, I'm going to use your education as reading some of the ED of it, that's okay.
Yeah, well.
And I think with the nursing supervisors too, having some education about it, they may be able to help troubleshoot or get the supplies that you need. But certainly there'll be people between CCU and PCU can always come and help if you need it.
Or at least help you find what you need, or the person you need.
Just to piggyback off that, and you mentioned this, but this is a one-way proprietary valve, so there's a little rubber stopper in here. Sometimes these patients will go to like ERs, maybe not here, but in other areas. I mean, I've seen them cut this off and try to do some drainage. I've seen them stick needles in here. Just remember, it has to be, you have to use the adapters that go with it, because anything sharp in here will pierce that, and then you have fluid leakage or air coming in. So just make sure you use Pleurx products to adapt to the adapter.
Did you have a question? Who else has a question?
Okay. How much does these little canisters hold?
This one holds 1,000.
Okay.
If for some reason you can tell them, the website, the CareFusion website, if you put in how to do it or whatever, it pulls it right up. It is a great tool. It was talking, I guess it would be more for your belly if you're like getting to that 2,000, So you fill this bottle, I guess I should have showed you how to break the seal. What they'll do is take this off. This comes off, I'm sorry. They make the hole bigger first, okay? They take this off, because this at home, they take it and they dump it in the toilet.
Okay.
And then they put it in a bag, and then they put it in the trash can. Okay, because of course they're not reusable or anything like that. But if they had to do another bottle, you just do the same procedure.
Okay.
So you just unhook it and put another one on.
And one more thing, you're probably not going to see these very often. They kind of come in spurts, but I'll leave some of these with you. Everything she just said on how to train is, as you mentioned, it's on the videos. You can download it on iTunes. You can see it on YouTube. But this little wall chart is helpful too. And these go home with every patient. So if their patient or their family member is training, they can look at it and be like, okay, now I got it. But once you've seen one, I mean, obviously you guys are skilled nurses, so you can figure this out. But it does help to get a little refresher every now and then.
Yeah, and they get this little pack.
Yeah.
So it has a DVD, and that shows you how to drain.
And we have all of Dwayne's information, so if there's any questions or any concerns come up, we can always contact him to get the support that we need as well.
Absolutely. Yeah.
Are we going to post one of those somewhere specific, you think? Do you
What,
want
this?
yeah,
We haven't gotten the CTO.
the
the thing we sent.
Oh yeah, we'll put it in the back and put everything else.
Just had to find room
Little
on the wall.
light reading.
Yeah.
All right, y'all good?
Woohoo, very good.
All right,